Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, dear colleagues. First of all, I would like to say thank you for the committee and also the faculty member of Diabetes and Ramadan Allowance for inviting me here. It is truly an honor for me. And in the session, we will discuss the issue of blood glucose monitoring for diabetes patients who are fasting during Ramadan. The key question we sought to answer was how often blood sugar should be checked to prevent any possible complication that may arise during Ramadan fasting for individuals living with diabetes. As one of the five pillars of Islam, Ramadan fasting is an annual religious practice that Muslims worldwide must observe for a month, from dawn to dusk. And during Ramadan fasting, also there are changes to daily routine, including altered meal timing and physical activity. Fasting may have certain health benefits, but it also brings challenges to specific patient groups, including those with diabetes. Although sickness exempts the individuals from the religious duty, many patients, including those with diabetes, choose to go ahead with fasting for social, cultural, and religious reasons, thereby often putting themselves at increased the risk of dysglycemia during the fast. In the month of Ramadan, there is a change from the usual eating pattern before Ramadan. A regular diet usually consists of 3 large meals, usually with breakfast at 6 a.m. and then lunch at 12 and then dinner at 6 p.m. But during Ramadan, we cannot eat or drink after sahur until breaking the fast. The fast is traditionally opened with followed by the main meal, which tends to be heavy and rich in carbohydrate. Between breaking the fast and sahur, food may be consumed with hot restriction and usually high calorie and fat nocturnal feeding. According to research conducted by Palayova, individuals with diabetes did not experience any significant differences in glucose exposures reading before, during, and after Ramadan, as monitored by the continuous glucose monitoring. Although there was a slight increased blood glucose level when breaking the fast, but the level remained within the normal range. The study from the Lesion et al. Analyzed the 24-hour continuous glucose monitoring profile the patient with diabetes during Ramadan and non-Ramadan. An interesting observation from the mean CGM curve during Ramadan fasting was the rapid rise in glucose level at iftar. This phenomenon is likely due to the type of the meal consumed at this time, commonly consisting of high glucose food such as dates, followed by the main meal. Furthermore, Lesion et al. Conducted a study using CGM to monitor blood glucose levels in diabetes. The patients were divided into 4 groups beside a control group of normal individuals. Group 1 are type 1 diabetes patients who were treated with diet alone or with metformin. Group 2, the patient treated with the gliptin. Group 3, the patient treated with the sulfonylurea. And group 4 included patients treated with the insulin. This slide shows a fairly sloping graph of the blood glucose sugar pattern over 24 hours in all the groups that were looked at before Ramadan. But in this slide, during Ramadan fasting, the mean CGM curve shows an interesting observation of a rapid rise in glucose levels after iftar. Although the primary reason for this is most likely the type of meal consumed at this time, other factors could also contribute to the rapid rise. One common practice among fasting Muslims is to eat food with a high glucose content, followed by the main meal. So, based on that data, it's likely to happen that Ramadan fasting can lead to several risks in diabetes patients due to changes in fluctuation in blood glucose level. Hypoglycemia is one of the risks associated with Ramadan fasting. According to the EPIDIAR study, there is an increase in the incidence of hypoglycemia by 4.7 times in type 1 diabetes patient and 7.5 times in type 2 diabetes patient. Another study, the CREATE study, found that the incidence of hypoglycemia was 7.1%, and it was categorized based on American Diabetes Association criteria. The incidence rate of hypoglycemia is higher for the higher risk category. In another study conducted by Rahmatullah et al., the incidence of hypoglycemia was found in 4.4%. The study also found that the incidence rate of hypoglycemia is higher for the higher risk category. It has been observed through study that there exists a correlation between the risk categories as defined by ADA or IDF-DAR and the occurrence of hypoglycemia. From several of these studies, it can be seen that there is a relationship between risk category according to both the ADA, and this also emphasizes the importance of risk categorization for diabetes patients who will fast during Ramadan. Another risk in diabetic patients who fast during Ramadan is the occurrence of hyperglycemia. The EPIDIAR study indicated that the incidence of hyperglycemia was 3 times higher in patients with type 1 diabetes and 5 times higher in patients with type 2 diabetes. According to research conducted by the Rahmatullah, the overall incidence of hyperglycemia was 10.8%. The risk category based on IDF-DAR criteria show that there was a relationship between risk category and the incidence of hyperglycemia. Again, this finding emphasized the importance of carrying out risk stratification in diabetic patients who wish to fast during Ramadan. Other risk factor that can arise in diabetes patients who fast is the diabetic ketoacidosis and dehydration. According to the EPIDIAR study, there has been a rise in the incidence of diabetic ketoacidosis among diabetes patients who fast. So, how can we prevent the potential risk for diabetes patients in Ramadan fasting? It is important to provide pre-Ramadan focused education to prevent potential risk for diabetes patients during fasting. Education should cover the timing of blood glucose monitoring to minimize the risk of severe hypoglycemia event and improve the quality of life for people with diabetes. Another education such as risk quantification, fluid and dietary, physical activity and exercise, also medical adjustment, and recognition of hypoglycemia and hyperglycemia symptoms, it is also essential. And Ramadan risk stratification is essential part of any diabetes and any Ramadan recommendation. The grading system was designed with attention for the various factors that believed to impact fasting. Each risk factor, including the kind and duration of diabetes, the presence of hypoglycemia, the level of glycemic control, the type of treatment using SMBG, and several other risk elements should be assessed individually and the result added together. The final score will determine the total risk level for a diabetic who wants to fast for the entire month of Ramadan. A risk score range of 0 to 3 denotes low risk, 3.5 to 6 denotes moderate risk, and more than 6 denotes high risk. Among the tactics used to guarantee the security of those fasting in any risk category is the frequency of self-monitoring blood glucose. It is pertinent to advocate for SMBG since the use of SMBG may assist diabetic patients experience fewer hypoglycemic episodes, lose weight, and improve glucose control. Self-monitoring of blood glucose should be done on an individual basis during Ramadan. More frequent monitoring is necessary for those who were more susceptible to hypoglycemia. The kind of diabetes mellitus and the medication being taken may influence how frequently a person checks their blood glucose level. For instance, those using sulfonylurea or insulin, which raise the risk of hypoglycemia, should check more frequent. Overall, the frequency of blood glucose monitoring is also influenced by the degree of risk classification. Self-monitoring can be done once or twice a day for a low to moderate risk and numerous times a day for very high risk. A 7-point monitoring approach could be useful in figuring out when it is appropriate to self-monitoring blood glucose. A 7-point monitoring guide may recommend it at the following times: pre-dawn, sahur, morning, midday, mid-afternoon, pre-sunset, iftar, yeah, 2 hours after iftar, and if there are signs of hypoglycemia, hyperglycemia, or feeling ill. There are a number of research that demonstrate that the actual implementation of SMBG, according to a research by Mansouri, just 10.1% of type 2 diabetes patients had daily SMBG exam. Most of the people who performed this examination did so prior to breaking their fast for iftar, followed by those who performed it afterward, post iftar 29.5%, and those who performed it when they felt sign of hypoglycemia. 22.3% of people conducted an examination before the sahur, and merely 3.5% conduct check during the day. According to study by Abid et al., type 1 diabetes patient had an average of 4 until 5 SMBG examination each week during Ramadan. But type 2 diabetes patient had an average of roughly 3 examinations per week. Another factor to consider is the precision of the tools used for SMBG testing. The risk of misinterpretation of blood glucose readings can be minimized by detailed information on the factor potentially affecting blood glucose measurement. Several factors such as human factor, device inherent, environmental, medicational, and also physiological factor can interfere the result of a blood glucose reading. So, for the summary, diabetes mellitus patients are at risk for fasting-related complication. And to mitigate the risk, systemic education and pre-Ramadan counseling, including self-monitoring blood glucose, are required. Use of the self-monitoring blood glucose is depending on individual risk categories. Blood glucose level should be checked more regularly as the risk increase. So thank you, and I really appreciate for your time and attention.